Well, here with us today is Dr. Harriet Schor. Dr. Schor is a family medicine physician based in Warren, Ohio, and an affiliate of Mercy Health, St. Elizabeth Youngstown Hospital. With over 30 years of experience, Dr. Schor's expertise spans to preventive care, integrative complementary medicine, and end of life care. She has also served as medical director for Grace Hospice of Ohio and pulmonary rehab. So Dr. Schor is particularly skilled and trained in lifestyle medicine. That's what we love. And the using of the therapeutic approach of lifestyle change in treating chronic conditions such as diabetes, obesity, and high blood pressure. And so today, Dr. Schor will share her professional journey and discuss the transformative power of lifestyle medicine, exploring its benefits for managing chronic diseases. So, how are you today, Dr. Shore?
I am doing great. How are you?
I am fine. What do you say, Dee?
We are doing great. Great. Welcome. We're so happy to have you today.
I am very happy to be here.
Yes, yes, yes. So, start with us. We want to know a little bit about you and definitely share it with our audience. How did you start in medicine, pursuing that career and then kind of leading to your journey of getting into, lifestyle medicine?
And don't go too far back because I remember you when you were a resident back in the day.
Well, and I'm actually going to go further back than that. So, I mean, from the time I was a kid, and particularly from the time I was a teenager, I'd always been interested in counseling and coaching. I wanted to be a marriage and family counselor actually before I even graduated from high school. So as I started applying for college and talking about a career path, I grew up in a medical family. My father was a PhD MD, and he and my mom encouraged me to go to med school with the aspirations to be a psychiatrist, because back in that day, psychiatrists not only prescribed medications, but they did their own counseling. So I went on the path, undergrad, get through the first 2.5 years of med school. And then as I got into my rotations, I loved every rotation I was on except for one, psychiatry. Because in the mid 80s, it was inpatient city county hospital. And Prozac was just being launched. So you had a lot of the old time medications that were probably more toxic than they were efficacious. So it really bothered me to go onto the wards and have the patients either be one end of the spectrum or the other. Either they were so medicated that they really couldn't communicate with me, or they weren't communicated well enough. So even if they could communicate with me, it wasn't optimal communication.
Okay.
So meanwhile, I was still very interested in psychiatry, psychology, and I was more interested in like the mind-body care of patients, young and old. So that's when family medicine really resonated as the perfect specialty for me. So, and as you mentioned, Vicki, I've got a lot of miles on the tread, 30 plus years. Has gone on. I've become really, really curious about the connection between what are known as the pillars of lifestyle medicine and disease management, prevention, and in some cases even reversal. So that led me to expand my study in lifestyle medicine, and I then became board just this past December. I use lifestyle medicine in my one-on-one visits with my patients, and I actually conduct group visits with about 10 to 12 patients every month to address lifestyle.
Oh, okay. So then since we're talking about lifestyle medicine and you talk about the pillars, there's 6 pillars of what their approach to, lifestyle change and all that. Could you, talk about a little bit about that?
Yes, so as you mentioned, there are 6 pillars. nutrition, exercise/activity, stress management, sleep, avoidance of risky substances, and connectiveness. So the focus is on embracing and optimizing strategies for each of those pillars, as opposed to traditional medicine, where most of the focus is on either medication or surgical prescription.
Okay. So, what do you have to say, Dee? You have to add something to that?
No, I'm just want to jump into this. I'm interested in all of this too because Dr. Shore, one of the things that we talk about are the blue zone people, and that's a lot about lifestyle and all of that. So no, I want to hear more.
Okay, so then with that, when we talk about the lifestyle approach, it is participating in behavior lifestyle changes and, treating chronic diseases and obesity and all of that. And so, with you practicing, do you have any stories or cases where you could see that happening, where the lifestyle medicine approach helped in treating, your patients with these type of chronic diseases?
Um, so I have some very inspiring stories from some of my group visits, but I have one patient that absolutely sticks out and absolutely resonates. I just saw him a week or two ago, and I told him I brag on him all the time. This is a gentleman, he's in his late 40s, has been an insulin-requiring diabetic from the time he's in his early 20s. Also has a complicated medical history of some other things, hypertension, hyperlipidemia, and also some mental health challenges too. He came in, I guess it's about a year ago or so now. He'd put on a lot of weight. And so his diabetes is not well controlled, his hypertension is not well controlled, all his numbers are whack. And I got curious and I said, tell me more about why the weight gain. So some of it was that he had a lot of medication changes through a psychiatrist, but he said, long story short, I'm coming home from work and I am further medicating with sugar.
Mm-hmm.
Okay. So I actually, so we talked in depth about with lifestyle medicine, what type of nutrition. I was kind of very specific. I said, so this is the kind of nutrition, specifically a whole food, plant-based way of eating that is, if you can comply to it like 80% of the time, you're going to achieve your goals. I also gave him some additional resources, which included some coaching. And we put together a SMART goal, which I was going to talk about a little bit later, about what he wanted to accomplish, what was like the one thing he wanted to accomplish. So the one thing he wanted to accomplish was cutting down, or preferably cutting out, on the overeating, and specifically the overeating of the sugar. So we put together a plan, and we agreed to meet 3 months later to see what his hemoglobin A1C was and his weight. So he embraced this. Oh my goodness, he embraced this. In fact, I was getting my chart messages from him weekly. So my blood sugar is dropping into the 50s and I'm taking this much insulin. I finally said, stop your insulin. Now, again, bear in mind, he had been on insulin for over 20 years.
Oh.
I said, stop your insulin. He was on some other oral medication. We kind of tweaked that a little bit. Fast forward 3 months, he came in, he had lost almost 30 pounds. His hemoglobin A1C dropped 2.5%. I think he had gotten up to like 8.5, something like that. He was down to 6,
Wow.
which technically is pre-diabetic as opposed to diabetic.
Mm-hmm.
So, I mean, I couldn't be more thrilled. And it really boiled down to identifying, he became very aware of what it was that was kind of getting in his way and creating a lot of discontent. He knew where he wanted to be. He honed in on it. He kept in touch with me more as a coach than as a physician, to be honest with you.
Yeah.
And achieved his goals. The best part of this was, yes, he reached his medically based goals. He said to me, everything else in my life is better because I've applied a lot of the principles of that SMART goal with my relationships and with my psychiatric care and on my job. That was so powerful.
Mm-hmm.
So, so his health and well-being was the tip of the iceberg.
Mm-hmm.
So that's how I feel that lifestyle medicine certainly can help. So, I mean, to be specific about the pillars, let me just kind of give you a rundown of the pillars. So nutrition, there's a lot of science behind the efficacy of lifestyle medicine. There's tons of research on evidence-based medicine. Nutrition, whole food, plant-based diet. Many studies out there to demonstrate that it can decrease the risk of cardiovascular disease, diabetes, hypertension, cancer, and it can even produce some reversal of some of these conditions, reversal of diabetes, even some of the reversal of some of the cardiovascular, once it's been diagnosed even. Exercise, 150 minutes a week of moderate intensity exercise. And this is how I counsel my patients on that. What does that moderate intensity exercise look like? Well, if you're doing something, you should be able to talk to somebody, but you should not be able to sing.
Okay. Yes. Yes.
So, and people get that. I mean, that really, it resonates, which is great.
Mm-hmm.
Sleep is an optimal 7 to 8 hours a night with adequate sleep hygiene and disease management. So, for example, if there's somebody who either has obstructive sleep apnea or is at risk for it, making a diagnosis, putting into play, the sleep hygiene as well as their treatment. And then if you get the other things woven into it, if you've got somebody with sleep apnea who, say, is obese and they start losing the weight, they may cure their sleep apnea and not necessarily need their CPAP. Stress management, and some examples of that are like yoga, meditation. Avoidance of risky substances, and the top three are tobacco, alcohol, and recreational drugs. The sixth pillar, and I found this interesting when I started to learn about it, is connectedness. Connectedness with self, family, and community.
Mm-hmm.
So, and they all tie in. People, at first people don't realize how they can tie in. So, and I know that there's a question later about how to kind of get to that, and I can wait till later to address that.
You can go ahead.
Dr. Schor, just can you run those down one more time? Nutrition, exercise, avoiding substances, toxic substances or substances, alcohol and tobacco and drugs.
Mm-hmm.
Connectiveness, and what were the other two?
Sleep.
Sleep.
And stress management.
Okay. One quick question. When you were talking about your patient, how do you keep them motivated? Dancing, singing. How do you keep your patients? I remember, I'm not in the office anymore, but just how do you keep them motivated on this process? Because once he hits that 30, how do you keep it moving?
I guess this would be a really good time for me to talk a little bit about the SMART goals. Mm-hmm. So when I'm taking a history, and with my Medicare patients, it's easy because when I do my Medicare annual wellness visits, lifestyle history is kind of built into that. If this is like a new patient or I'm doing an annual physical, I will ask about all of these different pillars. Mm-hmm. And if I'm hearing that there's one pillar that seems to be particularly out of balance, I get curious and I will ask the patients, are any of these out of balance for you? Well, for most people, it's either the most common ones are nutrition and exercise. Mm-hmm. So then I start asking the questions. We'll take nutrition, for example. Okay, so tell me more about your nutrition. Where do you feel that you're most out of balance? It usually takes a little while, but I can ultimately kind of pull from that, and I'll give them a little bit of a foundation. What you're eating, how much you're eating, when you're eating it, and why you're eating it.
Okay.
So sometimes I have to pull for that a little bit, but eventually I get to what their level of concern is. Then I assess their readiness, and there is a scale, 0 to 10 of readiness. 0, they're not ready to talk about it at all. 10, they're ready to change it right there and then. Anywhere from 7, 8, 9, 10 demonstrates a readiness to set up a SMART goal and start to pursue it. So I get their why. Why do you want to change? Why do you want to improve your nutrition? Is it to lose weight? Is it to feel better? Is it to get better diabetic control? And then say, for example, portion control is the issue. So we'll isolate that and we'll start to explore. So what tools do you feel that you have, or strategies do you have to limit your portions?